Autism spectrum disorder is becoming an epidemic in India, with 1 out of every 68 children developing this neurological disorder in the age band of 2 to 9 years. The current set of interventions adopted by healthcare practitioners are restricted to, behavioral therapies and, the pharmaceutical approach, basically antidepressants to impact the concentration of serotonin in the brain. But the question arises: how do children develop autism? And it all goes back to the gut microbiome of the mother. Yeah. So the autism develops even before the child is born. The microbial colonization of the child takes place in the mother's womb in the placenta. During the pregnancy, the mother's gut microbiome provides the right set of nutrients and biochemicals for the brain development of the offspring. And during the birth process, when there is a normal delivery, vaginal delivery, the child gets exposed to the mother's gut and vaginal microbiome. And even after the child is born, through breast milk, the child gets the mother's gut bacteria, right? And even after the child is born, and when the child is fed breast milk, the HMO which goes to the child through the breast milk, it is actually cannot be metabolized or cannot be digested by the child. It is actually metabolized by the child's gut microbiome, which synthesizes HMO into bitrate, which leads to which promotes the brain and the immune system development of the child. So if you really want to prevent autism, fix the gut microbiome of the mother. Make sure that the mother's gut microbiome is producing enough of beneficial metabolites such as bitrate, such as antioxidants, and suppress the production of harmful metabolites such as methane, ammonia, LPS, TMAO, right? So fix the gut microbiome functions of the mother, because if the mother's gut microbiome is imbalanced, it means the child's microbiome will also be imbalanced, and it will increase the risk of autism in the child.